guest, and esteemed members of the Human Services Committee. My name is Liz Gustafson, and I am the Connecticut State Director of Reproductive Equity Now. Thank you for the opportunity to testify in support of both HB 5482 and HB 5483. As a state and regional organization, Reproductive Equity Now works in Connecticut and across New England to make equitable access to the full spectrum of reproductive health care a reality for all people. Connecticut residents deserve to live in safe, thriving communities where all people can seek the full range of sexual and reproductive health care that they need with the insurance coverage that they deserve. Timely and consistent access to affordable contraception is critical for ensuring people can access and utilize the birth control method that meets their individual needs. Our state has made great progress in advancing contraceptive access, but there is still more work to be done to advance equity. Our state has expanded access by requiring most private insurance plans to cover a 12-month supply of FDA-approved contraception at one time, and HB 5482 builds on this progress by extending coverage to those enrolled in Husky. Regardless of medical need, income, insurance carrier, or proximity to a pharmacy, patients deserve affordable and accessible care. Additionally, Reproductive Equity Now believes that the decision if, when, or how someone becomes a parent is one of the most important life decisions we make, and everyone should be able to make that decision without barriers, which includes equitable access to fertility care. Connecticut's existing coverage for fertility care only applies to private insurers, which means that state residents insured through Husky are excluded from the existing coverage. HB 5483 would not cover the full range of fertility health care for Husky, but it is an important step to increase support for family building and for fertility preservation. As someone who has endometriosis myself and was also denied insurance coverage for fertility preservation, I know that firsthand how cost is and continues to be a significant barrier for those seeking and needing fertility care. And HB 5483 is an important step in recognition that here in Connecticut, all people and all families, regardless of insurer, who they are, or how much money they make, deserve access to the fertility care and family building health care they need to start or grow their families. Passage of both bills is a matter of economic, racial, and reproductive justice. Our state must ensure that no one is left behind and that all people have equitable access to insurance coverage of the health care they need. And we urge the committee and General Assembly to support both. And thank you so much for your time.